This is the surgical department of the Korle-Bu Teaching Hospital, but it's not as busy as it usually is because since Monday, the hospital has reduced the number of cases that the surgical department sees. Why? Because a number of health professionals that work in this building behind me seem to have tested positive for COVID-19, and as part of measures to bring down the pressure on the facility, the hospital has decided to not accept cases that are not emergency in nature. That means only emergency surgeries are going to be conducted for the next 2 weeks, and this began on Monday. Due to the nature of the number of positive cases that they have seen in this facility, we have not been allowed to go inside with our cameras. However, a quick peek into the facility, you realize that there are still several patients inside trying to get treatment. Some of them are there for various reasons, just to see their doctors or actually to carry out emergency surgeries. But all this is not surprising because according to management of the hospital, so far since the beginning of this coronavirus pandemic in March, 91 of its staff have tested positive for the virus.
In total, we have about 91 staff members who have been infected with COVID-19, but some have been treated already and discharged from hospital and they are back to work. So for the exact number of staff who are currently out, I need to work with others so that I can get you the exact number. But I'm talking about the cumulative figure since the beginning of the pandemic in the country. Some staff have gotten it in the line of duty. Others too may have contracted it from elsewhere, because we are not just health workers, we are also members of the larger community.
The regular contraction of the virus by the hospital staff seemed to have had a negative impact on its operations. Already, the Ghana Medical Association says more than 150 medical doctors and dentists have also tested positive for COVID-19 since the outbreak of the disease in Ghana. Pressure now mounts on the rest of the healthy staff to pick up the slack. But in the case of the surgery department, the latest arm of the hospital to record a high number of its staff testing positive for COVID-19, management hopes the 2 weeks period in which it will only attend to critical cases will afford a time for the affected medical staff to recover and come to work.
A positive case is detected in any area. The place is usually secluded, fumigated and cleaned before we resume work in that area. So it's like the standard now. So wherever you find that somebody has been exposed and is working or his patient is there, we close down and then fumigate. And then, as I say, 2 weeks is good enough period for those in isolation to undergo treatment and then come back to service. So within the 2 weeks period, that's what we have stated in the statement, within the 2 weeks period, I'm sure a good number of them would have been ready to come back to work, and then we will also revert to our normal services.
Our management says patients have so far complied with the directive to put on hold non-emergency surgeries until the 2 weeks period is over.
The response has been encouraging. Today the place is less busy compared to yesterday. We issued this statement yesterday in the evening, and I'm sure the information has seeped down very well. With such follow-up interviews, I'm sure it will further deepen. And then from tomorrow, then we'll see a clearer picture. Today, we still have some people, but the numbers have reduced drastically, but we still have some number of people around. But I'm sure by tomorrow, a lot more people will get to know, and then the numbers will further reduce.
A complete shutdown is not on the table for this hospital. What this means is that health professionals here at the Korle-Bu Teaching Hospital will continue to put their lives at risk to keep you and I safe and healthy. Reporting for Citi News, I am Niama Ama.